I've been a nurse for over 10 years, so I'm well aware that if you've ever discussed sleep difficulties like insomnia with your doctor, it's likely that you've been prescribed a sleeping pill or another medication to help you fall asleep or stay asleep. And these medications have their place during times of need, such as you're hospitalized, you're sick, you had surgery, traumatic events, or those brief periods of high stress that we're all susceptible to. They're intended for short term use only and typically prescribed for 10 to 14 days at most and meant to be taken on an as needed basis. However, the challenge to stay within these parameters arises when trouble sleeping becomes a nightly ordeal, which is the case for most people seeking medical help for their sleep. I have seen so many clients over the years who intended on taking sleeping aids for their initially prescribed 10 to 14-day period but ended up taking them for more like 10 to 14 years. And not only do we continue to take the medications, even when they're not showing any benefits, and we continue to struggle with sleep, the hangover effect that we experience after taking most of these sleep aids can actually be quite debilitating, causing us to feel drowsy with brain fog and muddled thinking, and even some physiological symptoms. This reliance on medication, driven by the fear of being unable to sleep without it, can lead people to accept these adverse effects as their new normal instead of seeking out more appropriate and sustainable solutions for sleep, like CBT-I, cognitive behavioral therapy for insomnia, which happens to be the gold standard first line treatment for insomnia, rather than temporary fixes like medication for sleep issues.